The four topics that I have included in my teaching include teachings for the laceration, breastfeeding, depression, and financial and appointment concerns. The reason why I chose the laceration is because the laceration itself puts the patient at a greater risk for postpartum hemorrhage. She also has been diagnosed with anemia, which puts her at a greater risk for postpartum hemorrhage. So I included the signs and symptoms to go along with that, and because of the second degree tear, I also felt that infection should also go underneath that category. So I included signs and symptoms of infection as well as hematomas, because hematomas can be caused by second degree tears or traumatic births, which can also contribute to postpartum hemorrhage. So that's why I chose that one as a priority teaching. My topic 2 was breastfeeding difficulties and ensuring the baby is eating enough. The reason why I chose that topic is because poor latch technique can cause failure to thrive in the baby, as well as causing mastitis in the mother and how do I want to put it? But it can cause the mother to not want to continue to breastfeed. So I put the signs and symptoms and things to look out for to ensure the baby is eating enough, what it looks like when they are not getting enough, and the benefits of a proper latch technique, as well as recommending to see a lactation consultant. My third topic was the postpartum depression, and the reason why I chose that is because the mother has a history of anxiety as well as postpartum depression with her first pregnancy. The anxiety, I do believe, is a current thing. It didn't specify whether it was prior or not. She also has stated concerns and feels overwhelmed with the thought of newborn care while having a toddler at home, which can also influence her feelings and emotions and exacerbate any kind of depression or anxiety that she may be experiencing. She also stated that the father did not live in the home, and while she has help from the mother, it's not really clear on what help the mother is exactly going to be providing and if the father is going to be present or not. Obviously, with him not living in the home, the father won't be able to help on a daily basis. That can lead to different things such as exhaustion, and exhaustion can exacerbate any depression or emotional feelings that are going on. So I included that in the teaching, as well as the difference between baby blues, postpartum depression, and postpartum psychosis, and the emergent factor with postpartum psychosis and when they should be contacting their provider to get help. The other one that I chose to teach was financial and appointment concerns, and the reason why I chose that one is because the patient stated that they had concerns about being able to obtain baby essentials. Not having baby essentials can affect the care that the baby receives. And not only that, but it can also affect the emotional state of the mother. I did not include that in my paper, but I should have. It also, the appointment aspect of it, that affects the care of not only the mother, but the baby. That also reflects back to the breastfeeding part, and making sure that the baby is eating enough. That is typically done at doctor's appointments. Most people don't have scales at home to weigh their babies and make sure they're feeding. So being able to get to the appointment is definitely of importance. So I recommended, community resources, and getting help with maybe setting up those appointments from like a social worker or something in the hospital if they don't understand. And those are my four topics that I chose for my teachings and why.